This video, we're going to talk about two supplements which every diabetic must take. The number one is vitamin D3. You want to take this supplement in order to prevent diabetic foot ulcer. Diabetic foot ulcer is a dangerous complication of uncontrolled diabetes. What happens that hyperglycemia causes reduction in your ability to repair wounds because of decline in immune function and decreased blood flow. And it is seen that people who have low level of vitamin D are at increased risk of developing diabetic foot ulcer. And this condition is dangerous because people who have diabetic foot ulcer are more likely to die than people who do not have diabetic foot ulcer. So it increases the rate of mortality in diabetic people. So you want to control this thing, you want to prevent this thing. And for this purpose, it is seen that vitamin D3 is very, very helpful because vitamin D is an immunoregulator. So it regulates your immune system and controls the cytokine production. Vitamin D also controls your blood sugar. So it helps in decreasing your blood sugar. Vitamin D also repairs the endothelium of your blood vessels and helps to repair wounds by improving the blood flow. So people who have low level of vitamin D and who have diabetes, they are at increased risk of developing diabetic foot ulcer, and you want to prevent this thing at all cost. And for this thing, vitamin D3 is very, very helpful. So the best approach is to first monitor your vitamin D level. So go and check your vitamin D level. And if your vitamin D level is 50 or above, then you can take a maintenance dose of 2000 international unit of vitamin D3 per day. If your vitamin D level is around 30, then you need to take 5000 of vitamin D per day along with K2, 90 to 100 mcg. Now, why do I say that you should keep your vitamin D level above 50? Because in my clinical experience, I have seen that if you keep your vitamin D level above 50, it gives you protection against a lot of acute respiratory tract infections also. And once you get any type of infection, once you get any type of disease, your vitamin D level falls. So it is always better to keep your vitamin D level well above the normal range. So I recommend that you should keep your vitamin D level always above 50 ng per ml. And if your vitamin D level is below 30, which is not a normal situation, then you have to take 60,000 international unit per week along with K2. And you have to monitor your vitamin D level after 6 weeks. And again, if it is well above 50, you can take maintenance dose of 2000. If it's still 30 or around 30, then you can take 5000 per day. And you have to make sure that you are getting enough magnesium and calcium through your diet. Then you want to take benfotiamine, which is a fat-soluble version of vitamin B1. Hyperglycemia causes accelerated formation of advanced glycation end products. Now, these end products are dangerous because they damage the glomeruli of your kidneys. They also damage the endothelium of your arteries. They damage the retina and the microvasculature. They also damage your nervous system. So you want to take an anti-AGE supplement. And for this, benfotiamine is very, very helpful. Benfotiamine also acts as an antioxidant. And when you have hyperglycemia, there is increase in the oxidative stress and increased generation of mitochondrial superoxide. So by acting as an antioxidant, it helps to protect your vital organs. So make sure to take a benfotiamine supplement as well. And the dose will be 150 to 300 mg in 4 to 2 divided doses. So you have to get around 600 mg per day. And even if you are apparently healthy, but if you are 40 or above, I will recommend you to take a low dose of benfotiamine supplement to delay the formation of advanced glycation end products. So for people who are 40 or above and who do not have any type of blood sugar issues, they still can take 100 mg of benfotiamine per day to delay this formation, that is advanced glycation end products. But before trying any supplement, make sure to consult with the doctor, inform your doctor, because you might be taking certain drugs, you might be having other type of issues which your doctor knows. So it's best to inform your doctor before trying any type of supplement.